Hello. The next topic is our separation anxiety disorders. Definition: separation anxiety disorder is an anxiety disorder characterized by excessive and developmentally inappropriate fear or anxiety about being separated from home or from major attachment figures, usually parents or caregivers. The fear is more intense and lasts longer than expected for the child's developmental age, causing significant impairment in school, family, or social functioning. Definition according to DSM 5: separation anxiety disorder is characterized by developmentally inappropriate and excessive fear or anxiety concerning separation from attachment figures lasting at least 4 weeks in children and adolescents, typically 6 months or more in adults. The symptom must cause significant distress or impairment. Introduction: it is normal for young children to experience more separation anxiety between 6 months and 3 years of age. However, in separation anxiety disorders, the anxiety is persistent, excessive, and interferes with the daily life. Children with SAD often refuse to go to the school, avoid staying away from parents, or become extremely distressed when separation occurs or it's anticipated. Epidemiology: one of the most common anxiety disorders in childhood. Usually begins before 12 years of age. Slightly more common in girls, often start after a stressful life event. Etiology: the disorders develops due to an interaction of biological, psychological, and environmental factors. In biological factors, family history of anxiety disorders, genetic predisposition, neurochemical imbalance, and temperamental tendency towards anxiety. Psychological factors: insecure attachment, low self confidence, poor coping skill, fear of abandonment, over dependence on parents. In family factors: over protecting parents, parental anxiety, family conflict, divorce or separation, death of a parent or loved one, inconsistent parenting. And in environmental factors: change of school, hospitalization, natural disasters, moving to a new place, traumatic experience, bullying. What are the risk factors? Family history of anxiety disorders, female gender, overprotective parenting, stressful life events, temperamental shyness, childhood trauma, chronic illness. What are the clinical features? Emotional symptoms: excessive fear of separation, constant worry that parents may be harmed, fear of getting lost, fear of being kidnapped, fear of sleeping alone. Behavioral symptoms: refusal to attend school, clinging to parents, crying during separation, refusal to stay with relatives or babysiters, refusal to sleep away from home. Physical symptoms: when separation occurs, the child may complain of headache, stomachache, nausea, vomiting, dizziness, palpitation. These symptoms are real but are often triggered by anxiety. Cognitive symptoms like persistent worries about losing parents, fear of accidents or illness affecting family members, recurrent nightmares about the separation. DSM 5 diagnostic features. What are they? These: the child may have excessive distress during separation, persistent worry about losing attachment figures, refusal to go to school, refusal to sleep alone, nightmares about separation, physical complaints when separation occurs, symptom persistent for at least 4 weeks. Diagnosis based on the details history, clinical interview, observation, DSM 5 criteria, information from parents and teachers. There is no laboratory test for separation anxiety disorders. What are the differential diagnosis? Differential from generalized anxiety disorders, social anxiety disorders, panic disorders, autism separatum disorders, school refusal due to bullying or medical illness. Treatment. What are the treatment? Cognitive behavioral therapy. The first line treatment. It helps the child recognize anxious thoughts, replace negative thoughts with realistic ones, develop coping skills, gradually face feared situation. Family therapy. Improve parent-child relationship, reduce overprotective behavior, encourage independence. Behavioral therapy. Positive reinforcement, gradual exposure to separation, relaxation training. Medication may be considered by severe causes or when psychotherapy alone is insufficient. Examples include selective serotonin, reuptake inhibitors (SSRI) or prescribed by a qualified physician. Nursing management. In nursing management, first assessment assess severity of anxiety, separation triggers, family relationships, school attendance, sleep pattern, physical symptoms, coping abilities. Mm, then establish a therapeutic relationship like build trust, speak calmly, encourage the child to express fears, provide emotional support, reduce anxieties like maintain a predictable routine, encourage relaxation exercise, teach deep breathing, use play therapy when appropriate and encourage gradual independence like encourage short periods of separation, praise successful attempts, increase independence step by step. Family education like teach parents avoid excessive reassurance, encourage independence, maintain consistent routines, reward brave behavior. School collaboration like work with teachers, support regular school attendance, create a supportive classroom environment, reduce unnecessary stress. Medication management like if medication is prescribed, monitor effectiveness, observe for side effects, educate parents about adherence, encourage regular follow-up. Complication. If untreated, separation anxiety disorders may lead to poor school attendance, academic difficulties, social isolation, depression, panic disorder, other anxiety disorder, so self confidence. Prevention. Promote secure parent child attachment, encourage age appropriate independence, teach healthy coping skills, reduce unnecessary family stress, early recognition and interventions. Role of the nurse. The psychiatric nurse should assess anxiety symptoms, build a therapeutic relationship, teach coping and relaxation techniques, encourage gradual independence, educate parents and teachers, coordinate multidisciplinary care, monitor progress and treatment response. Thanks for watching. Jai Jagannath.